Yes! It's the Megacast with Dave Scott, Tyler Keith, and even Ronnie Dahl. Good morning, Ronnie Dahl. Hello, everybody. And hi, Tyler. There's Tyler Keith. If you're watching us on TV, there I am if you're watching on TV. And really, the big news here today for radio audience, it's not going to be all that cool. All you care about is the snow. But for those of you watching on all of our video assets, we are in our brand new studio. Tyler, it only took us, what, a year to get this thing all figured out?
We had to find all the keys to the trap door in that other studio, and once we found that, this big room came in there.
All right, so let's do this. Hello, welcome to the Oakland County Megacast. Tyler, it's been so long I forgot all the other setup stuff that we do at the beginning of the broadcast. So
I can go right ahead. Yes, thank you for joining us on our main TV assets, Civic Center TV. And WBTV, Comcast channels 15 and 19, AT&T channel 99. Also, Comcast channel 15 and AT&T channel 99 in Birmingham, Bingham Farms, and Beverly Hills on Birmingham area municipal access. And then on the radio, of course, our flagship station 89.3 Lakes FM and lakesfm.com, as well as 88.1 WBFH The Biff. And today, we're on Facebook, as we are every single day on this show. Our Facebook partner today is one of our co-hosts, Ronnie Dahl, on her journalist page.
Well, how about that? And we should say good morning to Ronnie Dahl. Hi, sure. Ronnie. I'm not hearing Ronnie Dahl. What are we doing wrong?
Are you maybe muted? Do we have that muted in there?
I'm not hearing. See, we knew something was not going to work. Let's see. Maybe, do you think I'm muted here?
Is the codec up, or do you have PSI production?
We see Ronnie. Oh, you know that's
that's all that new tech.
All that. Ronnie,
he's got the beep boops and the bop.
Ronnie, it was my fault. I told Tyler, you can't run this stuff. It's way too complicated for you. And then I screwed up. Good morning, Ronnie.
Good morning, Dave. But what's going to happen if I have to try to run it? If Tyler can't do it, it's too complicated for him. I'm in trouble because you have the old school girl.
No. You're going to have a lot of fun when we get set up here. But it's a really very unusual scenario for radio and TV. This is the first studio, Tyler, that I've ever worked in, set up, built, constructed that is a TV studio and a radio studio all in one, and it's operated like a radio studio, but it's set up in a TV studio, and it's been configured. I think I can show you a shot if I just do this here. Let me just indulge me for just 1 second to hit a button or two. So there is there's the long shot coming back at me over Tyler's shoulder with the monitor there. And if we do this, you might be able to see the controls. I think I can do that and hit that button there. Forgive me, Tyler, it is a lot to run over.
It is. It's a lot. It was a lot in the old studio, and it's even more now.
But here you can see all the controls. You can see Ronnie over there on Zoom, and you can see all the controls that we have here. And then you see Tyler sitting over there. You got to get a better view of that when we go to Tyler's long shot, which I'm going to hit there and take to that right here. So there's Tyler over in his space. How's it feel over there, Tyler?
It's nice. It's nice and comfy over here. Just a bunch of room, good leg space. It's nice and cozy, Dave.
Well, and it should be. And Ronnie, you look cozy at home, too. You seem very comfy and cozy over there.
So, Dave, what people don't ever see is usually I'm still in my pajama bottoms or leggings and slippers.
Forgive me?
So I just posted to my Facebook page my days of, wearing my pajamas and slippers will probably be coming to an end.
Oh, no.
Well, actually, when
slippers in because of the snow, right?
Well,
it might be a good idea.
You can see how nice the whole setup is right here. This, by the way, Tyler, you don't see it from where you're sitting, but this is the quintessential Eugene shot. Eugene, one of our engineers who helped conceive this whole thing. And here's what we have to do. We have to look at Ronnie over on the TV right now, and then Ronnie, we can have a conversation back and forth. They see you on the TV through the long shot, and then you can talk, and we're looking over at you now on your monitor. Is that cool or what?
It's very high-tech.
It is.
It is. And then you can see Ronnie right there. So forgive us for all of the inside baseball. Is there something we're supposed to be doing right now, by the way?
We do have a loaded show. Plenty of headlines, of course. Always something new in the times of COVID-19 that we can be going over as well. And for that, we always have on hand, ready to go. She prepares these every morning. Ronnie.
Okay, Ronnie Dahl, the show is yours.
Well, thank you. It's so great, Dave, to have you with us, though. We want to say thank you to you and Eugene and the entire team of building this additional studio. And we should also let people know that one of the main reasons behind this is so that we can be socially distanced, just like the governor is asking and requesting of all the businesses. So we like to be in compliance, just like all the other businesses as well. But I will say it looks really great. You guys did an amazing job.
Well, thank you very much. So there, again, you can see from way off in the distance, kind of the whole thing. We got monitors, control board, all the video stuff. And what's different in this studio, so Ronnie, you're an experienced broadcaster. You've been in a lot of TV studios over the years, right?
Absolutely. As people may know, I was a producer. So the booth used to be my second home.
Right. Well, but when did you ever see a booth that was also the studio? Because that's kind of what we have here. This is the booth, and it's the studio. It's kind of been designed and akin to what's happening in the podcasting world. And then it's a throwback to radio in that we can run it ourselves. You know, and a large portion of that is because we're too cheap to hire engineers. But seriously, in community municipal television and radio, you can't have 50 people working on a show. When I worked over at WRIF a million years ago, Ronnie, they used to do this show in the afternoon on Channel 7. And it was John and Marilyn, okay? John Kelly and Marilyn Turner. You'll correct me if I'm wrong. And one day I looked at the staff list for that show, and there were 150 people that worked on this, you know, kind of afternoon talk show on TV. Ronnie, 150 people. Well, you know, we can't do 150 people here and have the whole thing work. Tyler, could we get 100? We don't know 150.
I'm pretty sure this building doesn't fit 150 people, Dave. It's a fire hazard.
Well, and certainly not in the COVID days. No. It doesn't fit 150 people. So we've kind of built this thing, as you can see, so we can run it now. Will we be able to run it and do the show at the same time? I don't know. Ronnie, I know you will be able to, but there's a really comfortable chair, Ronnie, where Tyler is sitting right over there. And, you know, that's the guest host look pretty chair. And look how pretty Tyler looks over there.
It's the first time for everything, Dave.
And I'm just going to do this live on TV. I shouldn't do this. This is a really bad TV, but I'm just going to pan the camera down here, Ronnie. This is a little bit for you. There's my controls there, but see, there's nothing for Tyler, no buttons or anything for him to operate. There's plenty of room, plenty of room for your computer over there, and you'll be happy. Now, I hope I'm not being condescending here, but I know that you don't have a great affinity for buttons.
I do not. I will say, but technology is changing, and that's one of the great things right now. Because, David, as you were mentioning, back in the day, you couldn't do this, but you can do it now because technology is changing, which is so great.
Right, and with that in mind, let's just take 30 seconds and talk about the other guy who we've not said hello, that I hope is standing by and can jump in here real quick, Larry Nyland, over here. Have you guys been putting Larry on TV?
Yeah, he's been here a few times.
All right, because I don't want to do something that we don't normally do anymore. But Larry Nyland, if you can take over, hit a couple of buttons there, and let's just check in with you real quick, because while this can all be operated in one place, Larry, it cannot be operated without a producer, and that's where you come in, and you're still going to be doing that from your home, right?
I am, yes. They do allow me on TV, Dave. Thank you.
I'm just checking.
I look great, don't I?
You look
fantastic.
Like you do.
Condo in the background.
By the way, what do you cook in there in the kitchen? It looks like you've got something going on back there.
Well, that may have been what was going on yesterday. So I'm not saying I'm not a great housekeeper, but that was yesterday's dinner.
All right. Well, very good. So, Larry, this whole thing, how's it looking from where you're sitting? Larry?
It looks great. I've got the TV up, too. You look great on the channel as well. So
okay, that's good. All right. So, there you go, everybody. It's the beginning of a bold new era. Tyler, I'll get out of the way here before it's all said and done and let you come on over to Master Control. But basically, I think it's kind of working.
Yeah, it's working really well. I think we're off on the right foot so far, Dave.
All right, so what's going on today?
Well, we got a lot coming up on the show. First off, we got to go through these headlines for today, and for that, as always, we go back to Keego Harbor in the home studio of Ronnie Dahl.
Okay, thanks, Tyler. So Beaumont allows limited visitation for patients without COVID-19. This is a positive sign right now. So Beaumont Health announced a change to its guidelines effective today, which will allow visitation for patients who do not have COVID-19 and are not suspected of having the virus. So if the number of cases goes up at Beaumont or within the community, they can make some adjustments once again. But like I said, positive news right now as they're changing their visitation. So how it's going to work, the new rules will include visitation of one support person for those without COVID-19. The hours are going to be between 8 a.m. and 8 p.m. Patients who are end of life or being evaluated for hospice care may have two support persons. Patients 21 and under may have two parents or legal guardians present, and one may stay overnight. I will say I've had a friend in the hospital. This is really great news. And I know that back in October, Tyler, when my mom was in the hospital, Ohio's restrictions were so much looser than they were here in the state of Michigan. So we were all able to go into the hospital and see my mom, which was great. So this is good news, and also a positive sign for us here.
Yeah, it's very good news for people that have had family in the hospital and those that are in the hospital on the daily that need to visit their loved ones or need to see them or just there for comfort. And we talked to Eric Wallace, the president of Henry Ford West Bloomfield Hospital last week, different hospital system, but he had a similar statement where Henry Ford is expected this week to loosen some of their restrictions for visitation as well, as the COVID numbers in Michigan are slowly but surely looking much more positive. The case numbers are down, the hospitals aren't as overwhelmed, and they're able to further control the situation with COVID-19 to a point where it's safe to let other people in, to a small extent, to visit their loved ones and their family that are being treated in the hospital.
On a little bit later in the show, and we'll be speaking to him more about this and so many other things regarding COVID. So stay with us for that interview. Also, we have to not forget research into COVID-19 is still underway right now. So research underway in Detroit is exploring the potential for convalescent plasma to treat and possibly prevent COVID-19 infections caused by variants of the virus. So Wayne State University right now conducting the clinical trials that are part of a Johns Hopkins University study to determine if the plasma could help prevent serious disease in people newly infected with COVID-19, or perhaps even prevent infections in people who have been exposed to the virus. Trial aims to enroll about 1,300 patients, with at least 500 of them in the preventive arm. There's about 700 enrolled right now. They are undergoing, and they do still need some volunteers for this. You have to be 18 years and older, and anyone who may be interested, go to our website, civiccentertv.com, and the link to the story. There's also a link to more information about this study, covidplasmatrial.org.
And we've seen this before. Convalescent plasma in the earlier portions of the COVID-19 pandemic did wonders in the research community in terms of treating COVID-19 and lessening the severity of symptoms in those at-risk areas. And with the COVID-19 variants that are out there, multiple variants, one of which has had a strong effect already in the local area in Washtenaw County, anything that the medical community can do to help slow down the effect of that much more potent and contagious variant of COVID-19, they're going to take that to heart. And convalescent plasma has been a treatment option throughout this pandemic for COVID-19. It's why the American Red Cross continues to ask on top of blood for convalescent plasma donations as well. And hopefully this research is positive and presents another way of fighting this much more contagious variant of COVID-19.
Can I just ask you experts a question?
Sure.
Because I've been out of the loop. It is getting a bit complicated right now.
Yes.
You talk about all the variants, whether or not you want to get the vaccine, all the different treatments, the new vaccines that are coming online, 2 shots, 1 shot, availability, on and on and on. And this is part of why you're going to do a special program on Thursday all about this, right?
Yeah, that's exactly why. And getting some of these questions answered about what can we do in order to fight off this more contagious version of the virus we've been fighting for a year. What kind of effect does it have different from the COVID-19 that we already have been experiencing and working around for the better part of a year, and get some of those other questions in addition to that on some of these research topics maybe answered to some extent as well on Thursday.
All right. Well, I'm looking forward to that. I know that, the community and everyone from Henry Ford Hospital and the supervisor's office in West Bloomfield and the other surrounding communities, I know that everyone appreciates the work that you and Ronnie are doing. And Ronnie, it's nice to be able to have an opportunity like this, to have so much time every day to get into the nitty-gritty and not be, locked into a 30-second soundbite, huh?
Oh my gosh, Dave, I will say I've watched when some of the people that we've interviewed on the show here, they'll do mainstream media. And even when they take them live for an interview, they're lucky if they're 4 minutes, 5 minutes max. And that's like special editions. So to be able to do this in this format really is beneficial to the community. And I will say, Dave, we talk about this. I learn something new every single day I do this show. Mm-hmm. Even when we have some of the guests on several times, the information changes every day as well. So it's great to be able to have this. And again, that vaccine hometown show is going to be Thursday starting at 9:00. So we do invite everyone to tune in for that.
I'm glad you're learning something. I get dumber every day. I don't know why. It just maybe it's something to do with my age, Tyler.
I don't know. I'm not gonna touch that one. I'm gonna plead the fifth on that. I don't entirely agree, but you know what?
Well, and I haven't been doing what you two have been doing every day. It is fun to do a show like this because, Ronnie, you can't help but be enormously informed. It just comes with the gig, right?
Absolutely. But Dave, that's why you're not learning something new every day, because you're not tuning into the show.
Well, I do when I can, but
I'm sorry, Tyler, I had to.
Usually for me, tuning in is like 4:00 in the morning watching a replay.
It's the best time.
All right.
Right. Dave is extremely busy because he runs about 20 businesses behind the scenes, besides also being involved here with us on the show. So we know that you're extremely busy as well.
All right. Well, very good. Tyler?
Yeah, so quickly, one more. We just want to let people know that Michigan has administered more than 1.5 million doses of the vaccine. So that's just about 2 months after starting the vaccination effort. More than 1.5 million doses have been administered to healthcare workers, people over 65, and others in Michigan. Keep in mind, though, the state is still under that phase 1B of the vaccination schedule. Counties around the state continue their efforts to administer 2 doses of the vaccine to people as they become eligible to receive them based on the state's guidelines. But, don't toot the state's horn just yet, because for those that are going through this vaccination process, trying to get an appointment can be very frustrating and very confusing as well. We talked to Larry about that last week as he was trying to get it for his mother. So it's great that we are getting more and more people vaccinated, but it is also very confusing on where to do it, how to get signed up, because there are so many different avenues as well. And you have to keep in mind that many of these people that are 65 and older, when we're talking about our seniors, they're not tech savvy. So it could be a little bit more.
I don't know about that. I may have to. Whoops, I hit the wrong button. I may have to. There was Mr. Wallace from the hospital there. I may have to challenge you on that a little bit because a lot of the seniors are retired. Some of them, they know more about what's going on. They have all the time in the world, but I get it. There's all kinds of people that aren't tech savvy and they don't really know how to access this information. So, that's what you guys do here every day, right?
That's exactly what we try to do for them, Dave. But so many of these avenues require for them to go online.
Right.
We've been saying that all, we just said it in our headline. Hey, for more information, go online. Hey, for this, go online. But I even have some of my elderly people who, I keep in contact, like activists and neighborhood people in Detroit, and they don't have the internet still. So they're trying to still do it the old-fashioned way of calling in.
Well, can I show them one easy way to do it?
Yeah.
Okay, so the really easy way to do all this, if I can hit a couple of buttons here. I mean, that's all you need. All you got to do, I'm showing the Civic Center website. All you got to do is go to civiccentertv.com and hit the coronavirus tab. And when you do that, you're going to get all kinds of coronavirus information. And you guys continue to do a great job of updating it. So if you're just looking for one place to go that's got all the links and it's easy, and I know you've said this a million times in the past, but always worth saying it again, all you got to do is go to this website. And then if this information isn't good enough, then you hit the Megacast link right there. And you go to the Megacast page, and then you can look at Ronnie and Tyler and watch the Megacast. If you missed it, you just watch the episodes right there, and that's all there. Or you go in and you watch the short clips that are right there, and you can get all the information. So there's an awful lot of ways, Ronnie Dahl, for people to get all the information. And if it's complicated online, just go to civiccentertv.com, for goodness sakes.
Absolutely. So, Dave, we should just talk one thing about that's going on right now. Our first guest, Dr. Bowtie, who is Dr. Todd Jenkins Jr., he was scheduled to come on at 10:20, and we're kind of like, where is he? Well, guess what? His wife just had a baby.
Oh, okay.
So he's not going to be able to make the show today. And I'm like,
what kind of lame excuse is that? I thought, the opportunity to come on the Megacast. No, that's a really good excuse. So congratulations to you and your family,
Absolutely.
sir.
That is awesome, though.
Tyler, do we have a backup plan?
We're working on it so far. We have not been able to move anybody up just yet. I know Larry's working on that with our second guest of the day. We had a couple other ideas to bring people in. They so far are a no-go, but we'll continue to work on that. All right.
Well, listen, you've got the most entertaining person in all of Oakland County right here in the set with you today, Ronnie Dahl.
Exactly.
Right? So, I mean...
No, I can't fill that much time, but Dave, I have to say that to you. But I will also say, Snowmageddon, one thing we have not talked about, Snowmageddon is coming. Earlier when New York was being hammered with all the snow, I was a little bit jealous. But now it's coming our way. And I don't think I'm jealous any longer because we have enough snow.
So let me ask you, Tyler, can we make weather references in the show?
That's fine.
Because, I know this is going to be aired again, but it will air again later on today, and it'll still be snowing, right?
Still timely.
Still be
Snow's still going to be here.
So it'll still be okay, so we can continue to make weather references here?
Absolutely. Absolutely.
Right. So,
Dave, by the time we go on tomorrow, it will really be snowing.
It's true.
Yeah, well, I was actually, what I was going to do here, if I can do it, and you two can talk for 30 seconds about something.
Sure.
I can pull some material up here.
Yeah, absolutely. Go ahead and do that, Dave. And we do have some good news. Our second guest, Dr. Skrynski, will be joining us at about 10:30, so a few minutes away. We will get into the meat of today's edition of the Oakland County Megacast. Moving things around, big things happen, and things have to change, and we adjust with it, as we always do. We've had this happen numerous times, and it happens all the time. And this is live TV and live radio. You got to just roll with the punches. So again, congratulations to Dr. Bowtie on the birth of his child, and a big thank you to the good doctor for joining us here in the next few minutes as we, in the meantime, investigate what may be coming our way with Snowmageddon, as it's being called.
Well, I will say, Tyler, last week we had kind of talked briefly when we were talking to the Rochester mayor about the sled hill that has the glow lights and the laser show. And we found out it was Bowers Farm and over there off of Rochester, which we loved them. Yes. By the way, I've been going sledding there like since my niece and nephew were little. Well, guess what? I went online to get tickets after that show. They are sold out for the rest of the season.
Wow. You know, we might have to use our connections. We might have to use our connections, Ronnie, because I happen to know some people over at near the Bowers School Farm, very good friends of theirs over at our one of our joining stations here on the family, WBFH. They do a lot of work there with the Bowers School Farm, actually named after the father of the original station manager at the BIF, Pete Bowers. So we have some connections. We may be able to get the inside scoop on finding those last little tickets that fall through the cracks. You never know.
Well, I will say, no shame in my game. I used our connections for my husband's Valentine's Day gift. You know, Ken Quattro we had on the show recently, who wrote the comic book about the history of the Black comic book artists. It's a beautiful book. And so I was able to get an autographed copy of that book following our interview. And that was my husband's Valentine's Day gift. So I think I scored major points.
That's a great gift. That is a great gift. Hopefully Woody very much enjoys that copy. It's a really interesting story. And if you haven't heard that interview with Ken Quattro, it is on our website on civiccentertv.com. Really interesting story, a really good story he's putting together in that comic, and interesting to get his perspective on how he put all of that together and the impact he hopes it has.
All right, ladies and gentlemen, with a special weather update from the Megacast Weather Center, here is our weather junkie, Dave Scott, with an update.
My God.
All right, how was that? Was that okay? All right.
We'll take it.
Taking a look at the National Weather Service radar, you can see that it is a mess. There's a radar as of our live moment, but the really interesting notes are over there on the right-hand side of the screen. Light snow starting to move out of the Tri-Cities area, but will continue to exit throughout the late morning. And then here's the big news, Ronnie. As you said, we're going to get a bunch of snow later on today. So expect the drive home today to be very snowy, today Monday, and then a fair amount of snow. They said 6 to 8 inches, maybe even a little bit more cumulative snow throughout the storm. So we have weather advisories in the area. You can see the St. Clair River. There's a flood warning there, and much, much more. Good place to go if you want to get the story yourself. weather.gov/DTX/weather story, or just go NOAA Metro Detroit, tell me what the heck is going on. No, just NOAA Metro Detroit, and you'll have everything you need. But clearly, snowy day here in our area. And Ronnie, you didn't drive 45 minutes to the studio this morning. I almost, oh my gosh, it was slippery out there. I almost drove my car right through the Maple and Telegraph intersection this morning, and I apologize to anyone else who was there around 7:45 this morning.
I did a little spin at Maple Road and Pontiac Trail just for fun, no other reason. It wasn't because of slippery conditions.
All right. Well, it is a mess. Be careful out there.
Yes.
And so I will say, Dave, did you know that I used to do weather in Lansing?
No.
Oh.
I did not know
horrible.
That. Did you do the thing in front of the screen where you would like stand in front of the screen and then you kind of look over in this direction and you're looking at absolutely nothing but green, and you try to make it look like you're looking at a monitor so you can kind of tell where your hand is? Do you do all that stuff?
It's much more complicated than people think, but way back in the day, the Lansing station, all they had was a weekend weather person / reporter, and I wanted to be a reporter, and so I said I could do weather. I knew nothing about weather, so I bought the book Weather for Dummies. I still have it upstairs, by the way, and then also a bunch of weather books, and it's still up there, like flagged with my questions and everything. Weather is pretty complicated, and it really is hard to get it right. But, you know, kudos to my coworker who was the actual main meteorologist on that show. He worked Monday through Friday. Michael Schlesinger, he was amazing. And
nice.
He was patient with me, but it was like, yeah, weather coming in, you know, snow. But what would be hard is in a small market they had a lot of time to fill, Dave, and they're telling you to go 3 minutes and 30 seconds, and there's nothing going on. So you'd be like, oh, high is coming through, and we're looking at sunny skies.
Well, Ronnie, this is not a minor market. This is a major Oakland County market, and with that in mind, we do need to move along. But thank you very much for that brief exploration into the Ronnie Dahl broadcasting history. I thought I knew everything about your career. I didn't know you did weather. It's really cool. So, Tyler, we doing okay?
We're doing all right. Yeah, we're right on time. Our first guest is connected, and we can get to him in just a couple minutes.
All right, so when I fire the spots here, then I put the slide up, right?
That's true.
All right,
That's
very good. Let's see if we can do that. Thank you very much for tuning into the Megacast. Dave, Tyler, Ronnie, and we will be back in just a moment. Don't go away.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so. Those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
We want to say thank you for taking time out of your day to be with us here on the Monday edition of the Megacast. As you may know, and if for those that have been watching, we are testing out our new studio. But in the meantime, I'm still at home. And so with that, we want to go ahead and jump into the show. Good news on the front of COVID-19, because we are seeing the numbers go down here in the state of Michigan. And with that, Beaumont Health Systems has also reduced some of the restrictions on their visitation rights. So with that, let's bring in Dr. Justin Skrynski. He's with Beaumont Hospital. Good, Doc. Great to have you with us here.
Good morning. It's a pleasure to be here.
So give us the latest update. I know that Beaumont Health is now allowing more visitors, but it's also, we have to keep that in mind to the perspective of what's going on in the community.
Yeah, exactly. So fortunately, our census is down at the hospital. And just like you said, that reflects what's going on largely in the area and in the state, and fortunately nationwide as well. So there's a couple reasons we can get into later in terms of why those numbers are looking better. One of the things we always want to emphasize is a huge thank you to the community, because a huge part of why this is becoming under control is the enormous sacrifice and all the hard work that everyone out there is doing in terms of masks, distancing, staying home, and just being smart in general.
But also a huge thank you to you and members of your team, because this has to be exhausting. We're like 11 months into this. How are you and the employees over at Beaumont holding up during this?
It is exhausting, and thank you for saying that. Everyone's holding up, and again, I think the vaccine was a big turning point for us, because you just feel like you're locked in this endless cycle of, all right, well, we have our lockdowns and cases are under control, and we start opening up and cases surge, and then just sort of rinse, repeat. And now finally you have this sort of off-ramp to all of that in terms of the vaccine. So morale is much better. Seeing the cases here decrease is much better. Still the same disease. Unfortunately, we are still seeing the same severity of cases, just not as many of them. So it's still a real thing, and it's not over, but much, much better than it was, let's say, going back to November.
Yeah, 11 months into this, and I think we've all known several people that have been impacted by COVID-19. But when we hear these numbers about ICU and ICU beds, can you give us a perspective from within the hospital walls? How many beds are typically assigned to a hospital?
Well, Beaumont's, I'm here at Royal Oak. So I can speak for our campus at least, and we have a very large ICU capacity. We've got our entire East Tower, which is 5 floors, is devoted to intensive care, and that's split between all the different specialties without going too much into specifics. So we have a very large ICU capacity. Dozens of beds. You go to some of the smaller areas and they might even have a couple beds or not at all. So in our case, fortunately, we've been able to absorb a lot of that capacity. And even though it got tight at points, especially during the kind of 2 peaks in cases that we had, fortunately, we never ran out of ventilators. We never ran out of ICU space. And again, now that cases are declining, we certainly have a lot more to spare. I think all of us are still a bit shy about what happened before, so we're keeping a lot in reserve in terms of having that available if needed.
I will say one of the biggest things I missed about Beaumont and what you guys do is your sweet dreams for, the kids. And I do know that they try to do it virtual this year, but that is one of the best events that you put on for the public. Not best events. You save lives every day, but it's such a sweet event.
Yeah, it really is. It really is. And it's just kind of wrapped up in the entire tragedy of the pandemic that we're not able to do things like that. As much as we'd want to, it's just, we can't encourage gatherings like that. It breaks all of our hearts. We here in the medical community, we feel it just as hard as everybody else. We're just people like everybody else. We all hate masks. We all hate having to stay home. But it's just a matter of trying to get through it together.
Well, and now that you did bring up the issue of mask, let's talk about that. Now we're hearing it's not only necessarily one mask, but maybe you need 2 masks.
Yeah. So the key word is layers. And that's if you, let's say, look at the CDC guidance that we're getting right now. One of the things they're recommending is layers. So for instance, I got my little show and tell here. So this is just a regular cloth mask. But a couple layers of material, and that's one of the important things. Now, the problem is a mask like this got its upsides, it's comfortable to wear, it's got a couple layers. It should be pretty good in terms of screening all the particles and droplets, but doesn't necessarily seal tightly. You've got a mask like this, which is one of our surgical masks. Again, it's got a couple layers of material to it. Also doesn't seal tightly. One of the new recommendations, which is exactly what you just mentioned, is to kind of combine these. So if you have a disposable mask underneath and then something like a tighter fitting cloth mask on top, that can help to seal the mask more tightly against your face, because again, you're trying to prevent all those particles from escaping. The main benefit still seems to be in terms of, again, catching all that's coming out of your mouth. That's why it's important everyone wears it. But also if it seals tighter, that's going to provide more protection to you as well when you're out in public.
We have seen some of the masks change throughout this pandemic, or at least the ones that are being sold like at your gas stations and your grocery stores. And they're starting to come with it's basically molded so that you could push it around your nose. Is that really, you need that, right?
Yeah, absolutely. And that's one of the benefits of the disposable masks, is that usually most of them have a little piece of metal that you can mold around your nose. Again, you're going to get a much tighter seal that way. And assuming you're breathing mostly through your nose, which you mostly do, you really want that tight seal around areas where air is going to otherwise be escaping. And again, that gets back to the idea of, okay, well, if you have a tighter fitting mask here, you've got another mask on top, pushing it, especially around the sides close to your face, that's going to give you the best seal and the most protection.
So, doctor, with that, I will say, and I'm going to admit right here, I am more of a fan of the neck gaiters, because I don't know how many times I forgot a mask. So it's easy to throw them in my car and then put them on and put them up, pull them out. Those really aren't recommended.
Not recommended, but I think that's a really important point, to the extent that something's always better than nothing. So you see people out of the grocery store and they're wearing a bandana, or they've got a gaiter or a scarf. Again, not optimal, but definitely better than nothing. And it's still appreciate the effort. So yes, if you just have kind of your sort of daily kit, as it were, where you have something like, a good fitting mask available, or disposable masks, which are increasingly common, that's best to have on hand. But again, if it's between that and nothing, definitely, if it's between a gaiter and nothing, definitely wear the gaiter.
So, Doctor, I have to say, though, I'm thinking about this because some of the people that are wearing a mask, so we're seeing it like on TV during the Super Bowl, there was a reporter and she was trying to talk through her mask. I was like, she sounds like the Peanuts teacher. And if you put two masks, I'm not going to understand you. So it's like two masks if you're not going to be talking to anyone.
Yeah, and I mean, I feel you on that one. I mean, I wear an N95 for a lot of the day too, and I think I still have my N95 lines here. But I mean, I lose my voice from shouting through that thing. So it's a pain, and again, nobody likes it. Even in the healthcare community, we're all sick of it. We don't like it. It's such a necessary evil, and especially for those people out there who are doing those frontline jobs. And I'm not just talking about healthcare workers, but all the frontline jobs. You're stuck wearing this all day, and yeah, it's a recipe for a sore throat.
You bring up a good point. I mean, for us, it's a minor inconvenience, but for people such as yourself that are working each and every day, it really is a life-saving measure.
It really is. It really is. And, again, if you look at all, it's so dramatic, it really is. If you look at all the projections in terms of, because again, we're not out of it yet. And I certainly don't want to be doom and gloom because we're doing a lot better than we were, but still not over. But if you project out over the next few months until we get most of the population vaccinated, how many lives you'd actually save just by universal masking, and you got to think, okay, each one of those, even if it's 100, even if it's 1,000, that's 1,000 people who could be here as opposed to not if we just all wore masks. So it's still, so critical. And a lot of people say, well, we've got vaccines. Why do we need masks? We've got treatments, which, that's another story. Why do we need masks? And the answer is because none of these things are 100% effective. And just the idea that such a simple thing can save lives.
But, some people argue too, well, the flu kills people and we're not wearing a mask for that. And the good thing, though, I do think about this, the number of flu cases have been down this year.
Absolutely. Absolutely. And that's been a question that's come up a lot is where's all the flu cases? And I think sometimes the implication is that flu is being, either unintentionally or intentionally misdiagnosed as COVID. But honestly, you got to think, okay, we're taking all of these measures to prevent against a contagious respiratory disease. And then you got to think, okay, well, all the other contagious respiratory diseases are going to decrease as well. So one of the silver linings is that flu has gone way down. And honestly, you might see masks persisting on an elective basis, even if they're not mandatory. People might just be more aware and more concerned to the extent that during flu season, that might just be the thing that we do.
So a couple of questions for you. One, we were having the conversation at our Sunday dinner last night. I have it with my sister and my brother. For people that basically their family of circle, let's say, if they've all had COVID, are they okay to continue to hang out together? Yeah,
and it's a pretty multi-layered question. I mean, the short answer is probably yes. The official answer, you definitely want to, try and keep household interaction in terms of number of households together. You still want to try and minimize, if possible, you still want to distance, do masks. There's a lot of encouraging research right now coming out that's showing that the immunity that you form either after a COVID infection or after a vaccine is actually a lot longer lasting than we might have originally thought. And if you look at related illnesses such as, SARS, so the sort of, original SARS, not this CoV-2 that we're looking at, but the original SARS, we see that people actually have immunity lasting many, many years from that. So the new research is very encouraging to the extent that hopefully people who were infected and got vaccinated are going to have protection for years. Now, to get back to your question about mixing households and continuing to do that, it's dicey. Is the risk high? Certainly not. Is the risk zero? No. So, my thought is if that's already your pod, so to speak, and that's what you've been doing, I think it should be okay to continue.
Well, I will say my sister is my twin sister, and she's like, well, we shared a womb together. But she does always blame me for stealing her nutrition, and that's why she doesn't play tennis very well.
Well, hopefully you didn't. Yeah, hopefully you didn't share viruses though. That's the only thing you got to make sure of.
Exactly. So with that though, Doctor, one of the big questions right now, we're really not focused on testing like we were prior to the vaccine. We know that before the vaccine came out, there was so much focus on testing, delayed results, but also the accuracy. How is that world? Have things changed? Have the testing results become a little bit more, let's say, reliable?
Yeah, so the testing technology has definitely improved. The PCR swabs, that's the one where, kind of go all the way back. Those were always, fairly accurate to the extent that they're not necessarily the most sensitive in terms of you can have false negatives, but they're very specific, meaning that you don't have any false positives. When those things light up positive, that means the virus is there. Some of the other tests, like the antigen testing, that's kind of mixed quality. Some of the antibody testing, that's kind of mixed quality as well. But you're absolutely right. And the focus has certainly shifted away from testing. And that's actually one of the things that some experts are saying might actually be contributing to the decline in recorded cases, is the fact that everyone's very focused on the vaccine, rightfully so. But testing's now taken a back seat because now people are less likely to go out and get tested because they're thinking, well, if I've got minor symptoms, I'll wait it out at home and I'll just wait my turn for the vaccine.
Oh, well, and because if they do go get the test, right, and if they're going to think they have it, and even if they get the test and it comes back positive, they're not going to change anything they're doing because it is mild. So therefore, if they're going to kind of self-quarantine, which I feel like we're all kind of in this right now, but if we can talk about the antibody test. So what exactly is that process for people who have not had it? Because we are hearing like you can get it at some grocery stores and pharmacies, or should people actually go to their healthcare provider to get that test?
Right. So the antibody test, I think, where it's done is not so much of an issue because usually they go to sort of the similar labs. But that's a blood test. And again, that's looking for the antibodies. So your own immune response against COVID. Now, that one of the things about that is it's good to know that you have them. So it's certainly good to know if you've had antibodies. That's definitely a marker that you've had COVID. So if you're concerned about the fact that you might have had a resultant infection, that'll certainly help you figure that one out. But the problem is that, first off, we can't verify if those antibodies are actually what we call neutralizing. So we can't verify that those are actually protective. So if you light up as having antibodies, that's not a free pass to say, well, I'm immune to COVID now, because that's not what that test looks for. It just says, hey, are there antibodies there? If the answer is yes, that test lights up positive. It's not saying they're functional. And then furthermore, especially now that we've got more variants popping up, it's not going to tell you whether or not you've got protection potentially against those variants either. So some pitfalls of antibody testing.
You're listening to 89.3 Lakes FM, 88.1 FM The Biff. Dr. Justin Skrynski with us here. He is with Beaumont Hospital, and listening to you say this, it kind of goes back to the beginning of this. Still a lot to learn about this virus.
Yeah, still a lot to learn, and absolutely, it's not like we were at the beginning. I'll tell you that much. We've got a lot more information than we had at the beginning, as you said. Lots of questions, but just because we have variants circulating now, just because you hear about things like B117 and B1351, that doesn't mean okay, here we go again, back to the beginning. We've made a lot of progress, and these are all hurdles that we're going to have to cross moving forward, but it does not mean that we're back to square one.
Is this going to be something that we are going to have a vaccine every single year, just like the flu shot?
That's an excellent question. And honestly, I couldn't tell you right now. My hope is that once you get control of the pandemic, you're not gonna see it really circulate in the population, sort of persist in the population. You look at other diseases, and sometimes they have what's called an animal reservoir, meaning that outside of people, the virus can kind of hang out somewhere in the environment and then reinfect people. And right now, it doesn't really look that way with COVID necessarily. that's a whole nother story. But long story short is that it seems like COVID is in people. And so if we get it out of the population for the most part, or have large enough immunity, hopefully we'll just see that virus sort of die out in the community and not really be able to persist. But also, if you look at vaccines like I'm thinking of the Johnson & Johnson vaccine, the AstraZeneca vaccine, those don't necessarily prevent all the cases, but they do take away the severity. So that's another possibility too, is if you can basically turn this into another cold, then that's almost just as good as getting rid of it. So it could still persist, but it's just not really going to land anyone in serious trouble.
Dr. Skrynski with us here. He's with Beaumont Hospital. I will say I'm waiting for the Johnson & Johnson, because that's just one poke of the needle versus two pokes of the needle. And when we're seeing the video of so many people getting that vaccine, that needle looks really, really large. But when it comes to your patients and the general public, especially the ones that are hesitant to get the vaccine, what do you want to say to them?
Right. So I say go for it. There's if you have doubts, reach out to a doctor, reach out to a friend. I think right now, one of the benefits of social media, we saw so many, just with everything going on, it's so many kind of toxic effects from social media. But one of the benefits is that there are very few people out there who don't know someone or have a family member or close friend who hasn't gotten the vaccine and can share their experience. So what I say is definitely go for it. The needle looks a little bit intimidating. I can say the nurse that gave me mine, she was a ninja. I didn't even feel it. It was crazy. Again, it's for the vast majority of people, there's no issues. If you do have concerns, if you're someone who's had bad allergic reactions, reach out to your doctor, talk to somebody who has some more information for you. The important thing is that you have to come to that determination yourself. Don't just take my word for it. You have to make yourself comfortable with getting that vaccine. So educate yourself, know as much as you can, and make that determination on your own.
Yeah, and one thing we are hearing too is there are a lot of people that are getting the vaccine that maybe are on the front lines, and so they're in that percentage that they're allowed to get the vaccine right now. And what they're saying, a lot of people is like, I'm not getting the vaccine for me, I'm getting it for you. I'm getting it for us to be able to go back to life as we knew it. This is bigger than me. This is about our community.
Absolutely. And, again, you got to think, COVID's got to leap from person to person to person to person. And the more of those spots you take out of circulation, that's the few opportunities that this thing has to continue to circulate around in our society. And you look at all the variants that are forming. That's tricky because the longer this thing exists, the more chance it has to mutate, to change, to possibly dodge the immune response, to dodge the vaccine. So it's not just a matter of saying, okay, well, we got to make sure that people just don't get super sick from it. That's obviously step one, is to treat the people who are critically ill. But you can't just let it go indefinitely, because again, the more you let it go, the more it's going to potentially change.
Okay, so for those out there, just a couple more questions because I know you have to go, but I will say anytime I can get a doctor on, because you guys are so much smarter than all of us, and plus you have the knowledge. So I'm asking the questions that I hear from some of the people that I know in our conversations. And of course, the conversation always comes back to herd immunity. And why not just let the people that are immune compromised be the ones that are in quarantine or self-isolating while the rest of the world goes about its business? Because wouldn't you get to herd immunity sooner?
The response I would have to that is you can definitely strive for herd immunity, but at what cost? And right now in this country, again, one of the there's a few reasons why people think things might be slowing down. One of them is we might be approaching a degree of herd immunity, especially in really hard-hit areas. I'm thinking of LA, for instance. But what's the cost of that? So you can reach herd immunity, but we've already lost 500,000 people. So you could certainly let it go and say, well, we're just going to let it burn through. We'll get herd immunity. We will be done with it. But what's the cost of that? And right now, COVID, when you treat it, if you end up in the hospital and it's treated, mortality is very low. But if it's not treated, you end up in a situation like you had in Italy a year ago, where it's 10% mortality, where it's 1 in 10 people could die from it. So, I think herd immunity in that sense is best accomplished by vaccinating, because it's once you get enough vaccines out there, it's the same phenomenon where, again, person to person, there just aren't enough susceptible people for this virus to keep jumping around.
I will say, I can't wait to be able to hug people again.
Absolutely. There's so many things that I miss. And I mean, honestly, it's been a year. And I mean, like last year, early last year, I think about January 2020, it just seems like a dream at this point, you know?
It really does. Good doctor, we so appreciate your time. But before I let you go, anything maybe that we didn't touch on that you want to add?
I mean, just to the extent that, again, just hang in there. It's, you know, this is not one of those here we go again situations. You know, we're making great progress. We're not out of it yet, but we definitely have an out now. And everyone's doing a great job. Don't get tired. Just keep going. And I think we'll have an answer soon.
You know, great words of advice for us, because you don't have the option of giving up and being frustrated. You still have to continue to do your job every day. And if anything, we need to support people such as yourself. Good Dr. Justin Skrynski with us. He is with Beaumont Hospital. We so appreciate your time.
My pleasure. Thank you for having me.
Thank you for being willing to make the sacrifice to keep all of us safe. We're going to take a quick break here on the Megacast. As a reminder, you can always catch us on Civic Center TV, Birmingham Area Municipal Access. Also tune us into Channel 15 on Comcast, 99 on AT&T. You can also tune us into the radio, 89.3 Lakes FM, 88.1 FM The Bev. This is the Megacast.
Hi. My name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue. But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Say thank you for taking time out of your day to be with us here on the Oakland County Megacast. For those that may be tuning in for the first time, this show actually grew out of the COVID-19 crisis. Dave Scott and Tyler Keefe decided to do the show as one way to bring you, members of our community, information about the coronavirus crisis. And back when they first started, they never imagined we'd still be in the middle of this 11 months later, but really our goal here is to educate you and bring you long-form interviews from the individuals and all of us impacted as we continue to try our daily lives. And with that, we're making a few changes along the way, one of them being a new studio. Tyler, the studio looks great.
It does. It looks really good in here. We're off to a strong start, as you can see in this wide shot here, a lot different than what we had before, a lot more technology, a lot more distanced out, and very spatial as we make an effort to continue to improve the programming here on the Oakland County Megacast and at Civic Center TV.
So I'll start to join Tyler back in the studio here this week. And we also want to just pass along a programming note that on the 18th, we will also be doing a vaccination town hall, because as we're moving into the second phase of this crisis, and it's about the vaccination, there are a lot of questions. And so we are going to work to try to answer those questions for you with a town hall, and speaking with some of the experts. So again, we want to invite you to also email in your questions to that. And again, you can do that. Just for more information, go to civiccentertv.com. With that, as a reminder, you are listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. And we'll kick off the second hour of the show. And with us, Matthew Majestic. He is the captain for the West Bloomfield Fire Department and program manager for the basic and advanced fire training programs at Oakland Community College, which means you're an ice expert.
Well, I don't know about, I won't go that far, but yeah, I've had a fair amount of training and background in ice and water rescue. One of the original members of the West Bloomfield Fire Department to actually start receiving training through ice rescue that we did back in the early 90s with the U.S. Coast Guard from Selfridge Air National Guard Base. We took it from there and turned it into the program that we do have today in West Bloomfield.
With that, Captain, sadly, we did start off this year with news that there was a gentleman on a snowmobile in Wolverine Lake that fell through the ice and did die. I know that West Bloomfield, I believe you guys have had a few ice rescues as well, and one in which a person's pet, their dog went out on the ice, and the dog did not survive as well. How common are those ice rescues for you and your team?
Well, sadly, they're all too common. We, in West Bloomfield, as you know, we have more, or I should say even in the greater West Bloomfield area, like Orchard Lake as well, we have more navigable inland lakes than any other community in the country, with the exception of one town in northern Minnesota. So as a result of that, we end up, the water is a recreational point and a big draw to our area. And when you have that type of a draw, you're going to put people on the water, and people are going to be placed at risk as a result of that.
Captain Matthew Majestic with us here on the Megacast. He's with the West Bloomfield Fire Department. And Captain, I have to say, we took our dog to the park, Dodge Park, this weekend, and even though we've had the freezing cold temperatures that we've had for pretty much the last couple of weeks, just taking a step on that ice still makes me nervous. And I had friends yesterday, they were out snowmobiling across the ice. What is the best practice if you are going to go out on the ice to try to figure out, is it safe?
Well, you know, we'll never say that any ice is safe. We are always going to say there's no such thing as safe ice, so please don't go out. But obviously we know that's not going to be the case. And I myself have been an avid ice fisherman all my life. So, but you know, we take precautions and we think about what we're doing. You know, the early ice, when it's just getting out there, some of the fishermen love to get out there because it's supposedly the best fishing. That can be hit or miss, and sometimes it's true and quite often it's not. But the biggest thing about getting out on that ice and getting an understanding of whether you're dealing with anything safe or not is how long have you had temperatures steadily well below freezing? And I'm not just talking 28 degrees or 26 degrees at night. I'm talking when we're getting steady temperatures that do not come above 25, 26 degrees for extended periods of time. And then you're going to get that good solid base of ice that's going to start building up. You know, a person can get on ice at about 2 inches, and I don't want to say safely walk or traverse it, but they can get across, yes, right? But, you know, when you want to get out on the ice, think about it. If we're seeing if a dog falls through the ice, right? If I recall right, your dog's about 60 pounds or so, 60, 70 pounds. If that dog's going to fall through the ice, what makes you think it's going to support you? But we love our animals. I love my dog, and God knows if anything happens, I'm going to try and save her, right? But we tend to lose that vision, and we lose our common sense a little bit. But if you're going out, when you see other people making the trek out there, and you see people skating, great, get out there. We want to stay active during this time of the year, right? But let people know you're going out. Don't go out. If you're going out alone, tell somebody you're going. Take the time to invest in one of the self-inflating life jackets that just flip over your neck and around the waist. They're not very bulky. They're not very expensive, and it might mean the difference between life and death.
But how does that work if you go underwater? Because the one thing with ice, let's say you fall through, but then the current takes you, it can be hard to find a place to break through the ice to come back up.
We'll have to take that into, we're talking two different things there. When in reality, the Detroit River is the only true flowing body of water in our area of real relevance. But even there, people aren't going on that ice per se, right? The ice that we have in the greater West Bloomfield area, there are no currents of any strength that are going to move you and take you under. Quite often when we go under, it's a straight drop and a pop up on ice when we're talking about breaking through ice. And the key there then is to try and get yourself a handhold. What recently happened where we did lose the dog, as you mentioned earlier. That dog was running towards the opening in the hole. That's the other thing. This dog did not fall through a drop down per se. The dog ran into the ice and slid, and then went in under, and then under the opening in the ice, which then added to the difficulty in retrieving the dog. So quite often people just drop straight down though.
So Captain Majestic with us here on the Megacast. You can always find us on Channel 15 on Comcast 99 on AT&T. Captain, with that too, I will say, if you're ice fishing or doing anything on the Detroit River, think twice. I always think about the contamination in the Detroit River. But beside that, the big popular thing for us in our area, ice skating and ice hockey. So if I'm with another individual, hopefully if there is a need for a rescue, one person is able to call for help. But in those frantic first moments, how should an individual respond?
Well, okay, first, when we're talking about the ice skating on the local lakes and what have you, I definitely always recommend, and you see it all the time. You see it on Pine Lake, you see it on Cass Lake, you see it on Middle Straits. Quite often the people who are setting up ice rinks for pond, what we like to call pond hockey, right? They'll clear off that area of snow because let's face it, you don't want to skate, or you're not going to skate on snow. So they're going to set up rinks fairly close to their homes. The nice thing is they're usually setting up rinks in water depths that are only anywhere from 5 feet, right? So for the most part, that's extreme, can be safe and controlled and things of that nature, right? It just comes down to being prepared and kind of watching what the situation is, keeping an eye on the temperatures, and knowing what you're dealing with. We have multiple types of ice that we deal with throughout the year. That the ice, when it first forms, is that ice that looks crystal clear when you look at it is some of the safest or strongest ice that we get. It's called columnar ice, and it almost looks like a TV screen that you can look right through, and that's great. The problem is what happens, like we've got now with the snow that we've been getting here. You start getting ice buildup or snow building up on top of that ice, and then what it does is it actually insulates it, and it actually causes degradation to the ice right below the snow layer. So that's why you'll actually get that slushy, water underneath there. It almost seems like a Slurpee or an icy type of consistency, right? And, even though it's very cold, that snow on top will insulate it and weaken that ice and cause it to degrade. That's why quite often a lot of people will actually clear that snow for that reason, to make it easier to skate on, keep the ice stronger, keep it clear, so they can actually see what they're dealing with.
See, Captain, that's why we have people such as yourself on the show, because I never would have thought about that, because you think, oh, it's been freezing cold, we're all good to go. Always great knowledge. Can we talk a little bit about your training and the training that other ice rescues and water rescue crews go through? What is that process?
Well, when it comes to ice and water rescue, that tends to fall, and it does fall into what we call technical rescue, and that falls under the National Fire Protection Association guidelines, without getting into all sorts of different standards, Nfpa standards. What it is it sets up a process of, quite often all of our tech rescue have a level of training, what we call an awareness level, an operations level, technician level, and then in other aspects it gets to specialist and beyond. But for the most part, our ice and water rescues are an awareness and an operations and technician level. And our people on the West Bloomfield Fire Department are all trained to the technician level when it comes to water rescue, to the ice rescue anyhow. We've got some new people, luckily we've got some new people we brought on, and we've not gotten them to training yet, but that's what we've been waiting for, with this wonderful cold weather, to get them through. But that training is, it teaches them all about our adversary, the ice itself, how it forms, how it builds, and then how it degrades. And then we teach them about the manner in which to deal with our victims. We teach them about different techniques, hands-on techniques to get the people out of the water. Also to teach them about helping the victims self-rescue if possible, evaluating the mental status of our victims and things of that nature. And we build on it as it progresses. It's a wonderful, it's that type of training which our people really enjoy doing, because it's something that, like anything else, when you see a victim in the water and you can pull them out and you make the save, it's a great feeling, and people really get a wonderful feeling from helping somebody. So.
And it really is one of those things where seconds count as well. What type of equipment is needed when you guys do these cold water ice rescues? Well,
we have our immersion suits, which you see if you've ever watched like Deadliest Catch or things of that nature, when they have the man overboard suits, right? And that's exactly what ours are. We use the couple different styles. They basically look like either the old Gumby cartoon character, it kind of looks like when you're wearing it, right? We actually call them Gumby suits, but basically those suits have the ability to keep us warm and dry in the ice water. We also have scratch alls, which are built into the suit, which are right in the forearms, which basically are a spring-loaded punch, if you will, that can dig into the ice to help us crawl. We also use, obviously, rope and throw bags and things of that nature. We use rescue slings, and then any flotation devices available to us. We can even do really well using our plastic backboards that help disperse weight across the ice and actually help get victims out of over sharp edges and things of that nature.
So with that, like, how long can you actually stay in the freezing cold temperatures with that equipment on?
Well, with the suits on, we can stay in for quite some time. When we go out, onto the various lakes, whether we're on Orchard Lake or Pine Lake for training, and that's where people will often see us doing our training. And we like to do it in public so that people know that we're out there and give them some sense of understanding of what we're doing. But once we're out there on the ice, it's very easy for a rescuer in a suit to stay in water for upwards of an hour and a half without any difficulty. The only bummer is when somebody kind of tilts the head up and a little water gets in around the neck, and guys aren't real happy about that.
I bet not. Hey, this is the Oakland County Megacast, and as a reminder, you can always catch us on 89.3 Lakes FM, 88.1 FM The Biff, as well as tuning us into your cable channels, 15 on Comcast, 99 on AT&T. And with that, Captain, I have to say, how often are you doing ice rescues because a family pet ran out onto the ice?
Well, in all honesty, I think the bulk of the responses that we do for ice rescue type calls have been for animals. Occasionally, at the very early part of the season, we'll get a person call through, or very late in the season as the ice is degrading, we get people calling through. But for the most part, it has been animals. We all love our pets, myself included, and we're going to get out there to try and help people get their dogs back, right? We've rescued multiple deer over the years, which is, I know it seems strange, but you know what? What we've also found is if we don't go out for the dogs or we don't go out for the deer, right, people are going to try and go. And we've got the equipment. It makes sense for us to go. Let us go. Call us early. Don't waste time. Get us on the way. We'll be there within minutes, and we'll get out there and we'll take care of it. But again, it falls back to, like I said earlier, if the ice isn't strong enough to hold a dog, what makes you think it's going to hold a grown adult, right? So get us on the way. We've got the equipment. Actually, even for the animals, we do carry. For that reason, we actually carry the dog snares, very similar to what an animal control officer would carry, so that we don't get bitten. We get out to the animal. We did that with the deer. Quite often, by the time we get out there, the animal is so exhausted from being in the cold water that they usually don't put up much of a fight. It just becomes an awkward thing trying to move them along the ice and through the broken ice and things of that nature.
Yeah, because I'm thinking about the animals, and it's like you said, that frantic moment, just like people sometimes will fight back when they're, potentially drowning and people are trying to save them and they're fighting and, moving around. Pets and animals and deer can do that as well. So it's great that you guys have that training, but also just as a good reminder, you're the experts. Let you go and do your job. Captain, always great having you with us because it's just, you guys do an amazing job and up against some very harsh elements. Anything that we didn't maybe mention that you want to add before we let you go? Because we are in the middle of the ice season.
Yes, absolutely. Please keep this in mind. If you're, as I said earlier, if you're going out, let somebody know you're going if you're going alone, right? So that people can know that you're out there. Invest in at least a set of those hand dolls that they sell them at all the sporting goods stores. Run them right through the sleeves of your coat when you're going out there, just like your ma used to do with your mittens, right? With the things out the end of your wrist. It'll save your life, right? The other thing is, if somebody does fall through, call us. Call right away. Don't hesitate. Don't try, the bad thing we found is 60% of our victims are would-be rescuers. And the last thing I'd want to say is, if somebody does fall in and they do manage to get themselves out, they've been in for more than 10 minutes, they need to be evaluated at a hospital. They need to be evaluated by a doctor. And quite often people get very confident and they don't want to go. I would say this for family members: if you had a family member that has fallen through and you got them out, and great, life is good. But watch for what we call the umbles, right? Watch for they're stumbling, they're mumbling, they're fumbling, they're grumbling. They've lost that kind of the hand-eye and the brain-mouth coordination, so to speak, right? and they're going to need to be evaluated by a doctor. So please don't hesitate to get them treatment, even when they don't feel like they need to go. If they've been in more than 10 minutes, they need to get seen by a doctor to be evaluated.
Well, thank you so much for that advice. Great advice to leave this interview with. And I will say thank you to you and the other members of your staff. Hopefully we don't need you this year, but we're so lucky to have you on staff and on standby.
Great being here. Thanks a lot. And please, everybody, stay safe, stay healthy, and be smart when you get near the water.
Most definitely, because it can be deceiving as well when you go out there and knowing where the beach ends and the water begins right now with all the snow and the snow that we're expecting over the next couple of days as well.
Absolutely. There's the thermic at 95 degrees and less. So it doesn't take much.
Right? Well, Captain, stay safe. We appreciate your time.
Take care.
You are watching the Oakland County Megacast. You can always catch us on Civic Center TV, Birmingham Area Municipal Access. Also tune us in to Channel 15 on Comcast, 99 on AT&T. We're going to take a quick break here on the show. And when we come back, we are going to be speaking with Kelly Houseman. She is a professional counselor, but also the host of her own reality podcast. What's that all about? That's coming up next on the Megacast.
Hi, I'm Dr. Faust, the medical director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Say thank you for taking time out of your day to be with us here on the Megacast. As a reminder, tune us into civiccentertv.com. If you have missed today's Megacast, previous Megacast, it's okay. We got you covered. You can go ahead and tune into some of our previous shows, but also if you click on the on-demand page, you can also just watch the individual interviews as well if you need to do that. And with that, we are going to go ahead and kick off the remainder of our show. Just about 40 minutes left here on the Megacast. And with us now is Kelly Houseman. She is a professional counselor as well as the host of Kelly's Reality Podcast. Thank you so much for being with us.
Thank you for having me. Good morning.
These are tough times, and we have been talking about it over and over again here on the Megacast, but people receive the information differently. And for those that are struggling right now, what signs do they need to look for to know it's time to ask for help?
Mm-hmm. I often tell people, if you're asking me or a friend, if you think that it's time to seek help, it probably is. And anything that is different from your typical routine, if you are sleeping more, eating less, not hopeful about the future, just not yourself, anything like that is a great time to seek help.
So with that, but when we wake up in the morning, how do you reset your day? And are there things that we can do or messages that we could give ourselves? It's the self-talk that can really start ourselves off on a positive note. How do we do that?
Yep. What I love is the power of mantras or quotes. And I actually love signs so much that I created a couple myself. So for me, this too shall pass. This is hung in my, when I used to have a physical office, I would hang it there. Now they are around my house, and one day at a time. I often encourage people, if you don't have a huge sign in your bedroom or your kitchen, write your favorite motivational quote, mantra, put it on a sticky note so it's one of the first things you see in the morning. And that's a great way to start your day off balanced and maybe a little bit more helpful.
So I guess I should switch out my coaster. It says save water, drink wine, Real Housewives of Kiko Harbor.
That works too. That could be a great mantra. I like it. It's a but
it really was supporting local because it was bought at the local store. But with that though, it really is important. It's just those little resets. So if someone finds themselves going down a bad habit path, how do they shift that?
Yep. We hear a lot about the power of gratitude, and I know it's really hard right now. There's a lot that's out of our control. There's a lot that we can't plan, but I try to at least, whether it's the morning or the evening before bed, trying to at least remember 3 very specific things that you are grateful for right now in this moment. And if people are having trouble, you can even bring it back to basics such as my heart is beating, my lungs are breathing for me. It could be a specific compliment or something your child or your spouse might have said, but really finding 3 things each day that are going right, that you did control, that made you happy.
Kelly Houseman with us here on the Megacast. She's a professional counselor and the host of Kelly's reality podcast. Right now, we're 11 months into this, and let's think back almost a year ago. It was going to be 2 weeks, 4 weeks. For those that are stuck in this cycle of depression, how do they get out of it?
Really setting your bar low right now. One of my biggest personal mantras is good enough is good enough. And really not trying to be all things to all people, cutting yourself some slack and just being good enough right now. I know it's hard. We are all struggling. It's been almost a year of this, and do not strive for perfection, especially now. Set that bar kind of low and do what you can.
But one of the things I think plays into this and this world of perfection, social media, especially Instagram.
Yep.
And I'm not a parent, but I'm a pet parent. But you look at some of these posts and these pictures, and people are really kind of putting a social perspective out there that their life is perfect, when that can impact and influence some people as well to feel like they're not living up to what everyone else is living up to.
Oh yeah. And this comes up all the time in my practice, in my personal life. And I really encourage people to be very mindful of those feelings that are coming up. If you're scrolling and you constantly feel depressed, anxious, not good enough after you're done, asking yourself, well, what kind of accounts am I following? Or what kind of friends do I have online that are putting this stuff out there? And am I okay with how I feel after doing that? If not, maybe it's time to unfollow, delete accounts, or spending less time online in general.
So with that, you do have a podcast. Tell us about that.
Yep. Actually, because of quarantine, I started this podcast where I got to interview celebrities and everyday people to talk about inspiring stories of how they got to where they are in their careers, whether they were athletes or reality TV stars or cancer survivors. And so that's been in a world of a lot of negativity, it's been a really nice thing to put out there that has some positive, uplifting vibes too.
It is fun. And one of the things you also do on that podcast, but also on your YouTube page, is trying to tell people, you're not perfect. We're not perfect. We're all in this world together.
Yes. Yep. And I tell my clients that all the time. I go, look, I'm a therapist. I know how to take care of myself. I know the techniques. I'm struggling too. My life is not perfect. I am a work in progress too. As long as I go and end the day being 1% better than I was yesterday, I'm good. But I think you hit the nail on the head. It's the comparison thing. Trying not to compare yourself to anyone other than the person you want to be, because it's just such a negative spiral and it's not getting us anywhere in life.
So what have you learned during this time of crisis?
Sure. So my husband's a frontline worker. He's been working more than ever. And I think for me, just about balance, I have 2 little kids at home. I'm trying to run a practice as well and manage a household and homeschooling. It's a lot. It's a lot. And I think, again, me setting my bar lower, I can't be the perfect mom right now. I can't be the perfect therapist. I can't be the perfect wife, but you know what? I can be good enough at all of those things. And that's made me very content and very happy.
This is Kelly Houseman. She is a professional counselor and host of Kelly's Reality Podcast. And as a reminder, you can always catch us on 89.3 Lakes FM, 88.1 FM, The Biff. Kelly, I have to say, so your kids, you haven't reached 5th grade math yet, though, right?
No, we are in kindergarten right now, so I can still handle it.
Because I will say, I'm like, no. If I had a kid at home right now and they had to do math, I'd be like, no, 1 plus 1 is 2.
A whole new method. I cannot relearn. I can't relearn much at this age anyway, let alone a whole new math. Not happening.
So have you been busier now than ever because of the pandemic?
Yep. My practice has never been more full. I get emails weekly. Kind of if that tells you anything about the state of the world right now. But what I love about that is people are realizing that, okay, if I am struggling, they're not afraid to reach out for help. And that makes me really happy that, it's a dark time right now. It's really tough. But the light in that is that people are talking about it. They're getting help and we're still moving people forward.
Because we are now talking about mental health more so than ever. And some of the statistics are staggering about how many people are admitting that they are suffering right now. This is a struggle for all of us. And it kind of comes and it goes. Like we have highs and we have lows. But do you think at the end of this, it could be positive for your industry?
I think so, especially now with the advent of virtual therapy. I don't think that's going anywhere. I think it's opened up a whole new world for clients and practitioners. And also, too, again, there's just been such a great turnaround of people not afraid to ask for therapist recommendations or talk about what medication they're on. But also, I try to tell people, you don't have to share your story either. For every person that's shouting from the rooftops about how much they love therapy, there's also people, therapy's confidential. You don't have to tell anyone what's going on. You don't have to tell anyone you're in therapy or what it's for. So you can find your balance. There's something for everyone. There's someone for everyone. We dedicate our lives to helping, and we want to get you back on the right track.
Kelly, with that too, what about, I feel like sometimes men are lost in this conversation. We are focused so much on moms and their stress during this time, but what about the guys?
Mm-hmm. Yeah, interestingly enough, I have seen an uptick in men seeking services as well. A lot of the times it is with a push from a girlfriend or a wife or a mom. But usually, I always say the first session's a little bit strange. It's awkward. It's a stranger. But the men that I have seen just talk about the power of an unbiased opinion, of somewhere to vent. So it is just as beneficial for men as it is women or children, teens. Everyone can benefit from therapy.
Because for some guys, they're like, hey, I'm the manly guy.
Right.
I'm not allowed to be weak.
Yep.
And that is not going to make them better.
Exactly. And, and that's okay if they feel like that. If they're not ready, again, to share that they're in therapy, everything is confidential with limited exceptions. So again, they can try it out. No one will know that they're seeking therapy and see if it's right for them.
Kelly Houseman with us here on the Megacast. She's a professional counselor and the host of Kelly's reality podcast. What made you want to do your reality podcast?
That is my guilty pleasure. That is my mindless log off from the day, watch reality TV. I like just escaping into reality TV or athletes or movie stars. So for me, and I wanted to know, what is their life like? Again, you talk about scrolling through social media and see perfect lives. No one exemplifies that more than a movie star. So I wanted to know, what is it really like behind the scenes? How do you keep your mental health strong? Do you suffer with social media comparison? And the answers I got were very surprising.
But I will say, when it comes to some reality TV shows, people are a hot mess, or at least they're portrayed to be that way, because we know there's a lot of editing involved. And sometimes that makes us feel better about our own lives.
Mm-hmm. Yeah, it's definitely, guilty pleasure, mindless, and wow, okay, I guess I'm not as as dysfunctional as perhaps I thought I was.
Go ahead and say it, because that's what I'm thinking, Kelly.
Yep.
Kelly Houseman with us here again on the Megacast. For those that may be tuning in for the first time, don't forget that you can always catch us on the Birmingham Municipal Access, but also it's Channel 15 Comcast 99 on AT&T, and listen to us on the radio as well, 89.3 Lakes FM, 88.1 FM, the Beth. Kelly, before we let you go, just a couple more minutes here with you. I feel like there's so much to talk about, because while we've talked about this, at least now we are seeing the statistics are starting to support what was underground in this world, and that mental health had a stigma, and people didn't want to talk about it. They're talking about it more now. Do you think the healthcare industry and the insurance industry is going to catch up and help support funding a lot of this treatment as well?
Yes, we certainly hope so. It's something that as therapists, psychiatrists, psychologists, we're all advocating for that. And the great thing is, too, there's people who can't afford it. There are programs out there. There are different places that are low cost, affordable therapy. So it's really accessible for everyone now, too, which is fantastic.
So if someone is experiencing burnout, maybe they don't have the funds to take off and go to Florida right now. All of my friends are going to Florida right now, right? And the people that are able to do that with remote work, they are taking off and going to other parts of the country where it's a little bit warmer, a little bit sunnier, but not everyone that's available to them. What can they do, even if it's for 10, 15, 20 minutes a day, to try to help them balance that burnout world?
Yep. Trying to find some way, like I said, even 10 minutes of unwinding, whether that is watching Netflix or listening to a podcast or, taking a walk outside. I know it's freezing right now, but finding some way to do that, that is essential. We can't, it's cliche, but you can't pour from the empty cup. You really have to give your body and your mind that downtime to relax, unplug for a little bit. Just take a breath, and then you can get back to the real world, but we got to take care of our bodies. It's the only one we have. So we have to prioritize that, make it happen.
Absolutely. Because if you don't take care of yourself, you can't take care of others. Mm-hmm. So Kelly, quickly, how can people find you, not only in your practice, but also on social media?
Sure. So my practice, and I see clients in the whole entire state of Michigan now with virtual sessions, and that is Kelly Houseman Counseling. And then if you want to check out my podcast or website, that is Kelly's Reality. And again, we have lots of celebrity mental health interviews, and it's nice and inspirational, kind of a lighter listen. I know there's a lot of heaviness going on right now, so it's lots of practical tips and mental health boosts.
Hey, so Kelly, you did mention telehealth. Do you think that's going to stick around post-pandemic?
I do think so, because it's just very convenient for us on both sides, and people seem more comfortable at home. You're in your home base, you're relaxed, and so I see this being the future.
But that's a great perspective. We appreciate you taking time out of your day to be with us here on the Megacast.
Thank you so much for having me. I appreciate it.
Kelly Houseman with us. She's a professional counselor as well as the host of Kelly's Reality Podcast, but you also have a YouTube channel, and we invite people to check her out. With that, we're going to take a quick break here on the Megacast, and when we come back, we are going to turn the conversation to one that gets us all riled, politics. This is the Oakland County Megacast.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together.
Together. For the latest information, visit oakgov.com/COVID.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
Love that PSA that says we'll get back to normal, because I wonder if normal, like we used to know it, is ever going to come. But until then, we are all making adjustments here in our lives, and including here on the Megacast. And one thing we are doing is we are outfitting a new studio right now there in West Bloomfield with the help of our mastermind, Dave Scott, as well as the engineer, Eugene. You guys are doing a great job, and Tyler is giving it a test run today. Tyler, how's it going?
So far, so good, Ronnie. We're doing well over here. Things have been going smoothly. It's a little bit different than
We're
before.
Missing Tyler's audio. I think he forgot to pot himself up.
No,
Tyler.
I'm on. Do you hear me? I don't think she hears me.
We still can't hear you, Tyler.
Okay, let me just check one thing out. That's interesting. That's very odd that you don't hear me now. Huh. We are all here, and I guess we're not getting back to you over there. Do you hear me now?
We do hear you now, Tyler. Okay. The studio looks great.
Interesting. It does. It does look great. It's functioning well.
No, we hear you now. We didn't hear you before, but I will say that.
Go ahead. Okay, something must be going on. Are you getting audio back to you from yourself?
Tyler, so it's a learning process, and we're going to work out the kinks. And while we work out the kinks, Tyler, just about 20 minutes left here in the show. Let's go ahead and bring in our last guest for the Monday edition. Yes. Tyler, can you pull me up on the show?
Yes, you're up live on the show, Ronnie.
So Tyler is working.
You're up live, yes.
To try to figure that out. So with that, Tyler, are we good to go? I want to go ahead and while you're working on things back there at.
Yep, you're all good to go.
Okay, Tyler, let's go ahead and bring in our last guest. Okay, let's go ahead and bring in our last guest. Again, we apologize. We're trying to work through the kinks of this new studio setup. And one of the reasons we're doing it is so that we Okay, great, Tyler. Let's go ahead. Dave Boucher with us here. He's the government and politics reporter for the Detroit Free Press. Dave, we apologize. As we were saying, we're building a new set and kind of testing it out today. You're a guinea pig for us.
Hey, it's all good. It's not a problem at all. I understand.
Happy post-Valentine's Day to you, and also early Snowmageddon.
Yeah, thank you. It's been President's Day as well. It's quite a Monday.
I know. I will say I kind of miss being a federal employee because we always got these days off. And I remember my first President's Day with the ATF. I went to work. No one was there.
Yeah, I get that.
We don't get those days off in news.
Indeed, we do not.
And speaking of news, oh my God, like just when we think things are calming down, they don't calm down. Can we talk about the Senate Majority Leader, Mike Skrynski? What is he thinking?
Yeah, obviously, like you're saying, the news of last week was a video that leaked of a meeting that he had with some Hillsdale County Republicans where he was recorded saying all sorts of things, chiefly that he thought aspects of the insurrection on January 6th at the U.S. Capitol were staged or a hoax. But he also got a lot of attention for saying that he contemplated challenging Governor Whitmer to a fistfight on the lawn of the Capitol. And he used, what many people consider misogynistic language to talk about how he bested her. I'm not going to say it, but how he bested her in legislative negotiations. So on top of all that, he had a hot mic moment in the Senate after that where he seemed to double down and say that he still agreed with the sentiment of what he was saying, even if he might have chosen different words in retrospect. So yeah, that's been the focus, at least of some at the Capitol and in politics this last week.
I will say, so sometimes I do media training as well. And one thing we always try to teach people is a mic is going to be hot somewhere. And you should know that. And knowing that, you should limit and edit your words and everything you say, especially as an elected leader, because what you say is off the tables. It's going to be shared. You need to know that in today's day and age. So I'm looking at this. Is he going to survive?
Oh, totally. Absolutely. I think he will. I mean, it's to your point, I'm sure that he has gotten media training. He has been a lawmaker for a long time. He was the head of the Senate last session. He was in the House before he was in the Senate. We haven't seen one Senate Republican man or woman come out and say something, that they were offended or that they disagreed. We've seen the House Speaker come out and say he's a Republican, say that he disagreed with the Senate Majority Leader's thoughts on the insurrection, and says that it distracts from the work of the legislature. But no, we haven't seen any movement at all from the Republican Party or from Senate Republicans in any way to even discuss whether or not he is the appropriate person to be leading the Senate.
So do you expect, though, that in the coming days it's going to gain traction, or is this going to go away?
I don't think it'll gain traction. We'll see. It came up last week and obviously gained international attention, and yet there weren't any resolutions filed by lawmakers to, call out his wording or to call on him to, step down. There was obviously the Michigan Democratic Party called on him to resign over something completely different, actually, over his contact with so-called militias. It was mentioned in a New York Times story that was kind of a recap of everything that local media had been reporting on with him and with the pandemic and with the plot to allegedly kidnap the governor. But no, we haven't seen a ton of traction. I am confident that Senate Republicans hope that this dies down and that this goes away, and that they can sort of reframe the narrative again to this idea that they think that the governor is unilaterally trying to fight COVID on her own. But no, I think I'm going to keep reporting on it. I know lots of other people in the Capitol Press Corps will continue to report on this. It's an issue that a lot of people are interested in.
Some of these things, it really is just kind of surprising to me. Like some of the issues that will gain traction to where it does lead for people stepping down, and other ones that seem to be even more offensive that it's like, okay, and they move on. Is it just an issue of what else is going on? Because obviously we had, in Washington, D.C., there was all the focus on the Trump impeachment trial, but also COVID relief is still a big issue that hasn't been worked out with our lawmakers.
Yeah, there's to your point, there's a lot of moving parts with policy. There's a lot of ongoing debates about how best to spend billions of dollars in federal relief aid to fight the pandemic. That hasn't gone away. Their negotiations are supposedly ongoing, although we don't know the status of that. I would say, and this was pointed out by one of my colleagues, a reporter at the Associated Press, but I think a lot of other people agree with this, is that if there was a huge sentiment in the Senate Republican caucus that they disagreed with Senate Majority Leader Skrynski's comments that aspects of this insurrection were a hoax or staged, we would have seen it. We haven't seen that. So the idea that you can remove someone from leadership for a concept that you might not disagree with, I think is part of why we haven't seen more of an outcry here about the comments that Senate Majority Leader Skrynski has made. And to be clear, and you know this, and I'm sure your listeners and viewers do too, this is not the first time he said something that a large swatch of the electorate might have found offensive. He's been called out for so-called xenophobic comments about how he's classified the coronavirus. He used an expletive and called the governor crazy back in April. This is not new rhetoric from him, and we haven't, again, seen Senate Republicans or Republican Party officials at the state or county level, apart from the Hillsdale County Republicans, really call him out.
Dave Boucher with us here on the Megacast. He is the government and politics reporter for the Detroit Free Press. And with that, Dave, I have to say, is this just one of those things where they say, yeah, it's Skrynski?
It might be. It totally might be. I think, again, we're going to keep reporting on it. I think the big question that came out after the January 6th insurrection nationally was how businesses and political donors will react when people espouse potentially dangerous rhetoric. So the morning after his comments were released on video, Senate Majority Leader Skrynski had a fundraiser for his political action committee. I went and stood outside, as did a couple of other reporters, to see if we could talk with the leader. He declined to comment, but we saw who some of these gold sponsors, so the big name, big money sponsors were, and I've reached out to all of them. DTE Energy was listed as a gold sponsor. Their spokesperson said that they didn't sponsor the event and they didn't know what he was talking about. So that was interesting. But and I spoke to another person who represents builders and construction employees in the state, and he had an interesting take on, I don't agree with what he said, but he's the most powerful Republican in state government. He's a leader in the Senate, and he has been good on our issues, which is something that you heard a lot during the Trump presidency as well, right? You might not agree with what he's saying, or you might not want to be his friend, frankly, but he has a lot of political power and a lot of political sway that could help you and your constituency. So that, I think, is also part of this dynamic.
Yeah, and I wonder too, as when we're talking about the political process and donating to some of the parties, but also these individuals, some of these big companies can hide between these PACs or behind the PACs when they're donating to certain individuals. And we should keep in mind, a lot of times they're playing both sides of the aisle.
Sure. The biggest companies, tend to donate to everyone. There have been a lot of statements post, again, the January 6th insurrection, where companies say that they're going to discontinue political contributions either to members who voted against accepting the Electoral College votes or just in general. DTE says that they have stopped all political contributions since January 6th while they reevaluate what they're going to do. This is one of those, it's right after a political cycle. There's still 2 years for all these companies to decide it is in their best interest to continue to donate tens of thousands, if not more, dollars to these political leaders. But yeah, it's something that we're going to continue to watch, and it'd be a shock if big money didn't start flowing back into political coffers in the very near future.
And look, we all know it's not going away. They'll continue to donate. They'll find a different way to do it, or you just wait long enough to where people's attention is, focused someplace else. Because these big businesses, they know that's kind of how they get some of their policies passed and are not only elected, but in DC as well. And a lot of people will argue that's one of the big issues with our political process. With that too, though, I have to ask, I know the last time we had you on, we were talking about the former health department here in the state of Michigan. Any new information that you can share with the quick departure of Gordon?
Yeah, so as you noted, Robert Gordon was the head of the health department. He resigned in something that was seemingly a surprise move. And the department almost immediately announced his replacement, who's a longtime senior executive at the health department. We're still reporting it out. There is more information that's coming out. I know that we're working to get more information out there, as are many other reporters. But the feedback that I'm getting from lawmakers and others is that they thought that the former director, Gordon, didn't listen as well as he could have. He didn't take feedback as well as he could have, and that there are stronger relationships with the legislature with the new acting director, Elizabeth Hertel. She has a confirmation hearing next week, essentially a confirmation hearing next week in the state Senate. It's before the Senate Advice and Consent Committee. The Senate has to sign off on these appointments. In the last couple of weeks, the Senate has decided at least a few times to reject gubernatorial appointments as like a show of exerting their power and as like a legislative way of saying that they want to be included in COVID talks. We don't know that that's going to happen with the head of the health department, but obviously, appointments have been a concern for the governor. So that'll be an interesting hearing to see.
Oh, well, and we should also mention that her husband is an elected leader as well. But with that, it's like you said, both people on both sides of the aisle said that they've had a better working relationship with her. But with that, have you been able to figure out, or any members of your team been able to figure out, with Gordon, did he leave with any type of severance package?
Yeah, we're looking into that. We're still looking into that now. We know that, as is the case with many, if not most, government employees, he was an at-will employee, so he wasn't on a contract. But he had an employment agreement, obviously. And so we are looking more into that. We will have something out soon, we hope, that will kind of delve into that a little bit more about him and the leadership and the circumstances surrounding his departure.
You're listening to 89.3 Lakes FM, 88.1 FM The Biff. We're speaking with Dave Boucher. He is the government and politics reporter for the Detroit Free Press. And I know that a lot of politicians like to talk about transparency, but we also know on the backside, when you submit a FOIA, for those that don't know, a FOIA is Freedom of Information Act. It is not just for reporters, it's for the general public. Sometimes even when you submit one of those, there are a lot of hoops that come along with actually trying to get the results, and also a cost involved in trying to get a response to a FOIA.
Yeah, that's right. It's all the information that your government has was paid for by you with tax dollars. And in order to get a lot of that information, you need to submit a request and pay more money to get taxpayer funded documents. So, and this is just in general, this is not in relation necessarily to former Director Gordon, but yeah, it's an ongoing concern and a frustration. And I know that my colleagues, both at the Free Press and at other papers, have written at length about legislative efforts to either increase transparency or talk about transparency, and they tend to not go anywhere. For example, to your point, the legislature is not subject to state open records laws, which means that if I put in a request for memos from, one state lawmaker's office to another, they don't have to tell me about it. They don't have to meet Open Records or Open Meetings Act requirements that indicate who's going to testify at a meeting 3 days in advance. There are all sorts of open records and open meetings law policies that apply to almost every aspect of state government except for the legislative branch and the governor's office. So that's something that has been talked about. Lawmakers have talked about changing that. Again, it's another one of those believe it when you see it sort of issues.
Yeah, we've had Representative Berman on with us a few times, and he's been pushing for the transparency. And it's like you said, a lot of politicians like to talk about it, but yet when it actually comes to passing anything, nothing is being done. And we like to remind them that it's not their information, it's our information. And as a former member of the federal government, you know that every time you send an email, that's open to a FOIA request. Even in a law enforcement capacity. Of course, there are certain things that you can and cannot divulge, but these individuals should know that that is one of those things out there, but they're being paid by us, the taxpayers, and we deserve that right And also it shouldn't come with that huge bill. I put in FOIAs before and you come back and it's like, sure, you can have that. It will take like 6 weeks to put that information together and cost you like $12,542. So that's kind of one way that they get around that. Dave, I'm really though interested, where do you think Michigan's GOP party goes from here on out?
Yeah, that's a great question. So there's been a change in leadership. Laura Cox, who was chair for the last 2 years, is out. Ron Weiser, who was previously the chairman of the party before, is now in. It was a surprisingly contentious election. Everybody thought that Laura Cox was not going to run again. And then a few days ahead of the election, she announces that she is going to run, but only so that Ron Weiser can't become chairman because she thinks that he was involved in some untoward acts that may have been in violation of state campaign finance regulations, to the point where she referred some of this spending to the state elections bureau. The allegations were that he paid somebody not to run for Secretary of State in 2018, a Republican candidate. Ron Weiser won the election of the party pretty overwhelmingly. Something like 2/3 of all votes were for him. And after he took over, they sent a letter to the State Elections Bureau saying, we were just kidding. Everything we did was fine. We're formally withdrawing our party's request for investigation. And the state essentially said, like, that ship has sailed. We're looking into this. So we'll see. We'll see. I mean, I think that that's indicative of like a interesting transition for the party, and that there is a kind of a grappling for power within the party between the people who think that they need to continue to support former President Trump and his initiatives and his ideas, and others in the party who can't wait to get away from President Trump and answering questions about his comments and his statements and his rhetoric.
Dave, just about 20 seconds left with you here on the Megacast. What's this been like for you to try to keep up with the politics here in the state of Michigan and the city of Detroit?
Yeah, it's like drinking from a fire hose, but that's what we signed up for. So I don't mind it at all. It's been interesting. It's been exciting. I've learned a lot, and I've definitely appreciated the experience.
And there is no break even during COVID.
Never, but that's okay.
Dave Boucher with us here on the Megacast. He is the government and politics reporter for the Detroit Free Press. Follow him, subscribe to the Free Press, and support local journalism. You're so important, especially now in the middle of the pandemic. That's going to wrap it up for the Monday edition of the Oakland County Megacast. I want to say thank you to everyone for tuning in, and thank you to Tyler and the team back at the studios as we work to get the new studio underway.